Hello, my name's Olivia and I'm one of the physiotherapists from Canberra Hospital who works in Paediatrics and Neonatology. I'm here today to talk to you about physiotherapy in the nursery and beyond. Now I just wanted to say first up, congratulations on your newborn baby. Now for some of you your time in the nursery may be relatively short, and for others whose babies were born early or for other reasons you may get to know everyone and their roles up there very well. But I just wanted to talk to you today about the role of physiotherapy in the nursery, positioning, development, head preference, equipment, frequently asked questions and follow-up options. Now the role of physiotherapy in the nursery includes developmental monitoring. So if your baby was born less than 1,000 grams or less than 30 weeks, if your baby has suffered a brain injury, or if your baby has required surgery in the first few weeks of life. We're also involved from a respiratory point of view, so sometimes physiotherapists are involved in helping your baby clear lung secretions or optimise lung function. We are also involved in assessment and treatment of conditions that affect baby's muscles or bones, and assessment and treatment of head preference or neck tightness. Now for your babies that are born early, we use corrected age for development. So your baby will have its actual age, so they're the weeks or months since your baby's birthday, and then its corrected age, which corrects for prematurity. So if your baby was born at 28 weeks, that's about 12 weeks early, or 3 months early. So when your baby is about 6 months old, we wouldn't expect your baby to be doing things of a 6-month-old, we would expect them to be doing things of a 3-month-old. For premature babies as well, if your baby was still in your tummy in those last few months, it would get stronger by pushing against your uterus wall or your tummy wall, and it would become more curled up as it ran out of room. It may like something to push against. Now that your baby's on the outside, we encourage flexed positions. So supportive positioning can help baby's muscular system, prevent complications associated with this, and prevent delay. It can also reduce baby's stress. Some positioning ideas for in the nursery and at home we'll go through next. So as you are nearing closer to home, remember SIDS guidelines, back to sleep and tummy to play. The aim of positioning is to keep baby curled up with arms in front of body, legs bent up, knee and feet facing forwards and head comfortably positioned. Try and alternate positions. Now one of the positions you will do in the nursery is kangaroo care, or that skin to skin. That's a really beneficial position for both baby and carer who's completing it. The other position you can try is what we call a containment hold. So no matter where your baby is, if they are unsettled or displaying kind of jerky movements, then you can place both hands on top of them, and that will help them resettle and help them reset their movement patterns, and we call that a containment hold. Swaddling is also really useful. So once your baby in the nursery is in an open cot, or when you're at home, you can swaddle your baby. You want to swaddle the baby with their hands firmly swaddled and their legs loosely swaddled. So you want legs to be able to kick and sit out to the side as the baby would like. This will help with hip development. Now, other positions you can do when your baby is on full monitoring, if your baby is a little bit younger or more unwell, are shown in these pictures. So you can do quarter off tummy time, and try and do left and right. You can do side lying, shown in this picture, just off their back, or on their back and in a nest, and this will give them something to kick against. Tummy and side lying positions can provide support for movement, encourage bent up positions and reduce startling of babies. Now your baby will give you cues along the way of when they are ready for interaction or when they need some space. So cues that I'm ready for interaction are steady breathing rate, they're awake, alert, stable oxygen levels, stable heart rate, stable skin colour and steady eye contact. If your baby has had a bit too much interaction, or they're trying to get to sleep, or they're agitated and overwhelmed, these are some of the cues that you look for. So they might increase or decrease their heart rate or breathing rate. They might change their skin colour, so they might turn pale, turn red, or go mottled. Yawning, hiccuping, jerky movements, getting fussy, arching their back or straightening their arms and legs, or looking away. If your baby is ready for some interactions and some developmental playtime, we'll go through some of the exercises that you can do with them. One of them is midline play. So you can do hand to hand, hand to mouth, hand to foot foot, leg cycling or pelvic rocking. And we'll show you a short video of those now. You getting old? Another really nice position is where they lay on your lap and looking up at you. You can get your baby to look at you and follow side to side. You can also talk to your baby in this position, and they often quite like it because they can see what's going on. I'll show you another short video of how you can get them to follow objects or your face, and just remember to talk and smile at them. Yeah, it's just... Now, probably all of you have heard of tummy time. It's a really good position to start strengthening baby's neck muscles. The easiest place to start in the nursery is up on your chest, so in that skin to skin or kangaroo paddle kind of position. And what you want to do is gradually recline. So the more reclined you are, the harder it is for baby and the more they'll have to work to strengthen their neck muscles. You can also do it in the cot over a rolled up towel, like in these positions. You can do it on your lap, over your leg, or when you're at home on the floor or on a mat. Now, picking up through side lying is also another good thing to do with your baby. It will feel a little bit funny to start with. So what you want to do is roll them onto their side, hold their arms together, and then pick them up through side lying. Once they're upright, you can pop them on your chest or pop them in the position that you want to carry or hold them in. What it does is strengthen baby's neck muscles, and it doesn't allow their head to fall backwards or for them to startle. With your baby's head shape or head preference, we want you to offer them a variety of positions. So that includes tummy, back, side lying, alternating carrying positions, giving them lots of opportunities in different positions. So while baby is so little, their skulls are very easily moulded to external forces. So if they're preferring to look to one side, they may develop a flattening on one side of their skull or a plagiocephaly. To avoid that, we want to encourage symmetry. Get them to look both ways. Try and alternate their head position once they're asleep. So place them on their back to sleep, and then you can alternate their head position, left for one sleep and then right for the next sleep. Offer them time in tummy time or time off the back of the head or their preferred side. You could do sideline play, so left and right sideline play. Offer them play time, so again follow Sid's guidelines, back to sleep and tummy to play. So give them opportunities off the back of their head during playtime. So that includes things like bouncers, car seats, bean bags, anything you're using for baby to position them in during the day. Make sure you're giving them time off the back of their head. You can also alternate their carrying positions. So place them upright in a carrier or hold them in a variety of positions. This not only helps with head preference, but also helps them to develop their visual fields, so how they see and how they use their arms and legs. If it's difficult to alternate their head for sleep, you can also tuck them in the alternate ends of the cot. So if you were putting them down to sleep and their legs were facing one way one night, the next night you would put them down so their legs are facing the other way. The other thing when you're encouraging them to look both ways is use what you have and what they're interested in. So use faces or siblings or light, where food comes from, their favourite toys or mobiles, all of those things can help. If you notice your baby developing a preference to one side or any flattening, encourage them to look to their non-preferred side. So if they prefer to look to the right, approach them from their left side. Like I said, use light, toys, siblings, faces, or anything else to encourage them to look to the left. And this includes on the change table, in a car seat, on the floor, with their play mats, all of those kind of things. You'll put them on their back to sleep and place them on their non-preferred side for 2 sleeps and their preferred side for 1 sleep. So in this example, you would put them on their back with their head turned to the left for 2 sleeps and their head turned to the right for 1 sleep. You could do sideline play. Again, you want to do, in this example, the left side lying more than right side lying. Now we don't want to encourage them just to look to the left and develop a preference to that side as well. So you do need to do a bit of both sides too. I would just try and do most of it towards their non-preferred side. Keep up with tummy time. It's a really important way to strengthen their neck muscles in all positions, and it also gives them time off that flat spot that may be developing. All of these strategies can help prevent that flat spot from developing or prevent it from getting worse. Now, equipment that they can use, there's lots of them. This is not an exclusive list. So what I would encourage is lots of floor time. So once you get home, give your baby lots of opportunities on the floor, on a mat, on their little playpen, with baby gyms, all those kind of things, as much as they can tolerate. Let your baby guide you for what they are ready for. So if your baby starts to look like they're ready to roll, if your baby starts to hold on to you, starts to grab things, those kind of things, then you know they're ready for the next step. The other things that we recommend are things like baby carriers and baby rockers, where they can kind of be placed in. Now, the other thing I just want to say is remember to set up equipment for you as well, and think about your feeding position, play positions, and the setup of change tables and things. You have been through pregnancy and birth, and it's all kind of new, holding babies, back to feeding if it's not your first child, all of those kind of things, and you need to look after yourself as well as do all these developmental things with your baby. The things we don't recommend as physios are things like jolly jumpers and baby walkers that they stand in. The reason for this is that they hold them around the middle, so they don't actually work on developing the strength of their own postural muscles in the same way. They can also develop muscles strength in the back of their legs, which encourages things like toe walking, rather than develop muscle strength in the normal way that we would if we let them develop at their own pace, using floor and pulling to stand and all of those kind of things. Now we've come to frequently asked questions. Can I use bought swaddles? Yes, you absolutely can use bought swaddles. Most of them are what we call hip happy now. So they do what I've talked to you about before. So they're tight swaddles around the arms, and then they're loose swaddled around the legs to allow baby to kick and to place their legs out to the side. I like the visual reminder to wrap them like a samosa and not like a spring roll. Can I use something to help position my baby's head to their non-preferred side? As per SIDS guidelines, we don't recommend using anything to prop baby's head to their non-preferred side. It can increase the chance of suffocation and of SIDS. I would put them on their back to sleep and place them on their non-preferred side. If they roll back or continue to go to the preferred side, I would just keep trying the next sleep and encourage them during the day and during their awake hours to look both ways so they're getting time off that and it's not getting flatter, which makes it harder for them to move. The other thing sometimes that works is that once they're asleep, you can then position their head to their non-preferred side and they'll stay there. My baby doesn't like tummy time. Do I have to do it? It's really important and really good for your baby to start doing some tummy time. You don't have to do very long to start with. I would just start with a minute or two and I would start in a position that they like, such as upright on your chest or over your lap. Like I said, you may only get a minute or two and then they will get upset and that's enough tummy time. And I would just try that a few times throughout the day. How often should I do the developmental exercises? Like I just said, again, it depends on their tolerance and how much they are ready for that interaction. I would try some of the developmental exercises before a feed and you might only get 1 or 2 exercises in. So you might get some hand to hand, hand to mouth, and that might be it for that period of time. Then the next time before a feed and they're awake and alert, you might do a little bit of tummy time. And then you could alternate through them. The next question is, my baby has reflux. Can I still do tummy time? Now probably your baby won't like being completely flat very much. So I would start with a position where they're upright on your chest and then gradually recline a bit. The flatter they are, the probably more upset they will get from their reflux and that uncomfortable feeling. So we would stay semi-reclined for them to still work on their strengthening the neck muscles, but not causing that reflux. How long do I do them for? These exercises will be suitable up until about 3 months past your baby's due date or birth date, depending when they were born. So if your baby was born early, wait till their due date and then 3 months past that. When your baby starts to show signs that they are ready to do other things, such as they're pulling your hair, grabbing your clothes, doing those kind of things, or starting to roll from their back to their side or their tummy to their side or back, these are signs that they may progress. If you are seeing a physiotherapist already from a development point of view, they will progress your program as appropriate. The next question is, when should I see a physiotherapist if I'm worried about head preference or development? If you are concerned while your baby is in the nursery, get the nurse to page physiotherapy. If you have been referred to physiotherapy on discharge, discuss it with them when you are worried. You can start to implement some of the strategies if it's a head preference from this video and then bring it up at your next appointment. If you're having concerns and you're not linked in with physio, raise it with your matched nurse and they can find appropriate physiotherapy for you. If you live in New South Wales, I would talk to your matched nurse, so your maternal and child health nurse or your GP, and get them to link you into the right services. If it's a head preference, you could start some of these strategies before you see them and see if that helps with that. If you're an ACT resident and you have head preference concerns, you could go through community health intake and the number is here. If you have developmental concerns and you're an ACT resident, you could go to Child Development Service and the number again is here. So give them a call and state what your concerns are. Here are some other useful resources for you. Now finally, I just want to say, enjoy cuddles and playtime with your baby.